and local and national peace and security. Therefore, it is an evolving challenge that all players at the national and county levels must fold their sleeves and tackle to avoid the lethal consequences of this menace. Indeed, illicit alcohol and substance abuse among youth affect not only the individual users and abusers, but also their families and society. These effects include neglect of responsibilities, increased trends in criminal activities, including organized criminal gangs, violent crimes and international drug trafficking, interpersonal violence, diminished attachment to family and others, impaired self-regulation and problem-solving, decreased development of prosocial attitudes and behavior and health impairment, including mental disorders, reduced life expectancy among the users and abusers. In addition, studies show a death rate of 2.5 times higher than normal among users and abusers. These rates are highest among young adults aged 18 to 35. Youth in this age bracket constitute about 60% of Kenya's national population, hence being the most vulnerable group. Allow me to demonstrate how deep this malaise has become ingrained in our society here in Nakuru County. Sometime in September last year, a 30-year-old resident of Elbagon in Molo sub-county, serving as an assistant county commissioner in Vihiga, took a short leave to visit his family in Nakuru. With some free time, he went on a night-long drinking spree with his friends in Molo, and sadly, he died the following day from alcohol poisoning, ending a promising administrator's life and leaving behind a young widow and children orphaned at a very young age. On August 8th of 2021, 10 people in the Hodi area of Bahati sub-county died after consuming what tests confirmed to be poisoned illicit liquor. Another 6 people died 4 months later in December 2021 after consuming illicit brew in Jawadho village, Njoro sub-county. Similar deaths arising from illicit brew consumption have been recorded in Molo, Kuresoi South, and Kuresoi North sub-counties. Where deaths have not been reported, you will find once able-bodied youths have been turned into zombies after using drugs and abusing substances that are now easily available in urban centers and villages. Your Excellency, investigations and studies reveal that the purveyors of this menace have devised ways to continue their deadly business under the noses of administrators and security agents. The merchants of this business in Molo, Joro, Bahati, Kuresoi North, Kuresoi South, Gilgil, and parts of Nakuru City have become so enterprising that they conduct their businesses in toilets and even in cemeteries to escape the prying eyes of security officers and administrators. Informal settlements in urban centers in the county have become dens where these merchants conduct their businesses, exacerbating the sorry state that already exists in those areas. In Nakuru City, areas of Kaptembwa, Kivumbini, Kuaronda, Canyon, London, Morogi, and other densely populated slums have become stomping grounds for peddlers of drugs and merchants of illicit brews. Efforts to stamp out this menace must begin in these areas. To stem the spread of the malaise, which is morphing into a security threat at the national and county levels, all players, political leaders, security agencies, the clergy, and the relevant state agencies must work together. It is evident that weak laws, regulations, and low fines have largely contributed to the state we are in regarding illicit brew consumption. As a region, we must develop strong legislation that provides punitive consequences for peddlers of drugs and merchants of illicit brews. Here in Nakuru County, we are preparing a law to this effect. We will seek the support of the national administration of the national government and security teams in the county in the fight against these illicit brews and use of drugs. In the meantime, we have tightened the issuance of licenses to bars and wines and spirits outlets. This year, out of 3,654 applications, licenses were issued to 2,919. 445 were rejected. We want to guard and ring-fence our youths from illicit brews and the use of drugs. In conclusion, I want to thank the national government for identifying the dangers of this menace and bringing us together to discuss and find ways of containing the spread of illicit brews and the use of drugs. This is a fight that we cannot wish away because the consequences are worse. In fighting against this business of death, we seek to reduce poverty, unite families, mold a healthy workforce, clean our politics, entrench harmony and peace in our society, and promote security. I'm convinced that we will have a clear route to tackle this challenge by the time we leave here today. So thank you very much, Your Excellency, for leading this fight. It is no easy task, but I'm sure you and all of us together are up to the task. It is now my pleasure to introduce Your Excellencies, my colleague governors. And we have Dr. Mutai, who is the governor of Kericho, and you will have time to speak during the plenary. We have Jonathan B. or Koti Moja from Uasin Gishu. We have Hilary Barchok from Bomet. Thank you. We have Benjamin Cheboy, my neighbor from Baringo, who stole my flamingos, but they're back. We have Patrick Ntutu from Narok. We have Governor Irongo from Laikipia. We have Deputy Governor Yulita Mitei from Nandi County. Have I left out any present governor? Let me also take the time to introduce my deputy governor, or the deputy governor of Nakuru County, DG Kones Asanti. I also noticed on the screen there that I saw the majority leader of the Nakuru County Assembly, and any MCAs, if you also can stand up, I think that would be nice. Thank you very much. Asanteni, thank you very much. Oh, they are from other areas also? Oh, okay, all the MCAs, stand up. Sorry, I didn't realize that. No, we did, leader. Okay, thank you very, very much. And for you, the members of the, is it the press? Mumeniona? Niko sawa? You am report pia.
Thank you, Governor. Now, I want us to move straight into a presentation by Madam Eunice Rubia. Eunice. Now, as Eunice comes on stage, I want to once again acknowledge the heads of various agencies present here. Maybe you could just stand up so that you wave to the delegation here, the delegates. So I can recognize two. Of course, the head of NACADA, acting CEO, Mr. Muteti. Then there is the acting Commissioner General KRA, Madam Rispa. Yeah. Anti-Counterfeit Agency, thank you. And Kenya Bureau of Standards. So, Madam Eunice, the floor is yours.
His Excellency, the Deputy President of the Republic of Kenya, the Cabinet Secretaries present, led by our Cabinet Secretary, Minister of Interior, the Principal Secretary, elected leaders, that is senators, members of parliament, women reps, our governors, Regional Commissioner, Rift Valley, all the county commissioners in attendance, not forgetting all the leadership of the various agencies, including the chairperson for NACADA, all the various director generals and the CEOs, including the acting CEO of NACADA. Eunice Arubia, I work with NACADA as the regional head for North Rift. I'll be making a presentation on behalf of the region. We are looking at the alcohol and drug abuse situation in the region. And to begin with, we came up with objectives that we wish to achieve from this particular sitting. The first one is to highlight alcohol and drug status in Rift Valley region. We shall also be keen to assess the strategies employed to counter alcohol abuse in this region. Thirdly, to develop a sustainable strategy for the effective crackdown of illicit brews and counterfeit alcohol. And we also want to mainstream alcohol control at community level and to facilitate rehabilitation of persons affected by alcohol and drug abuse. As an introduction, our country is confronted with a serious and growing problem of alcohol and drug abuse, which is cutting across all sectors of the society, affecting the health, education, manufacturing, environment, and the security sector. Some of the effects of alcohol and drug abuse include diseases which are related to alcoholism, family breakages, crime, mental issues, illnesses, suicide, low productivity at the workplaces, as well as poor academic performance and indiscipline in schools. Rift Valley region is gravely affected, with the youth particularly wasting in cheap liquor and its related effects. Therefore, we commend His Excellency, the Deputy President, Honorable Rigathi Gachagua, EGH, for taking the lead in the war against illicit brew and drug abuse in the country. The bringing together of the region's leadership is a demonstration of the government's goodwill and efforts of curbing the menace. Looking at the prevalence, particularly pointing out from the survey conducted by NACADA, this particular study the findings were officially unveiled by NACADA. So I'll be pointing out just the key areas, but the full report is available on our website. So looking at the prevalence in terms of those that have engaged in using at least one drug or substance of abuse, you'll find the national percentage stands at 17.5, but for Rift Valley, our region, it is 14.1. With the use of alcohol, the national statistic stands at 9.7, but for our region is 9.6, a difference of just 0.1. Then with tobacco, the national level is 8.5. For us as a region, we are equally the same level with the national, standing at 8.5%. With CAT, what we refer to as MIRA, national statistics stands at 2.6%. The regional statistics stands at 2.1%. Cannabis, which is also bang, national level is 1.9, and at the regional level, we are at 1.2%. Potable spirits, which is also a big menace to us as a region, as you can see, from the regions there, Central comes number one on that with 4.1, Coast follows at 3.2%, and our region, Rift Valley, comes closely there as the third at 3.1. But compared to what we have as the statistics of the national prevalence levels, the national, we stand at 2.5. You can see, actually, the first 5 regions are even ahead of what we can accumulate together as the figure for the national level. Then at the national level, in terms of consumption, the male are the most affected at 4.8%. Females follow at 0.6%. When you compare potable spirits used at both urban and you compare to rural, you find the urban population is the highest affected, actually using at 3.6%, and the rural at 1.9%. alcohol consumption in terms of age, we'll categorize between age 15 to 24. That is for our region, it stands at 4.0%. The most affected of that age bracket is between 25 and 35%, standing at 11.8%. As a region generally, alcohol consumption is 9.6. I'd looked at those figures earlier when we were just short of 0.1% from the national percentage. A summary of current use of drugs for Rift Valley in terms of population. For alcohol, we are 673,828 people who are affected by the use of alcohol, followed by tobacco, which is at 598,988. Thirdly is cat, what we call mira, is at 146,997. Cannabis follows, which is also referred to as bang or marijuana. It's at 84,832 people affected by the use of cannabis. For prescription drugs, it is 13,325. Multiple substance use, that is people that use more than one substance, it stands at 385,892. Those that have used at least one substance, the total population is standing at 991,814. In terms of severe use and developing substance use disorder, those are the people that require intervention in terms of treatment and rehabilitation. For alcohol use as a region, we have a population that is in dire need of services of rehabilitation at 319,946. For tobacco use, we have a population of 269,726. For cat, mira, we have a population of 43,207. For cannabis, it is 43,386. And lastly, prescription drugs, which is a serious menace currently with the young ones, is at 9,670. Situational analysis. When we looked at this largely, this is what came out from the survey. The region is largely affected by the use and proliferation of changa and portable spirits that are extremely potent. Secondly, there is a worrying burden of alcohol and tobacco addiction in the region that transcends across all ages. Also, the findings show evidence of early initiation to drug and substance use in the region. As well as the data from the region shows that the age between 25 and 35% years is the most affected by drug and substance use, as well as the burden of addiction. As we saw earlier, that age bracket was at 11.8%. The region is also emerging as a key market for heroin and cocaine use, especially in the two counties, that is Nakuru, specifically Nakuru town, and Uasin Gishu, that is Eldoret town. Abuse of prescription drugs for non-medical use is another emerging challenge in the region, especially for those psychiatric medications like diazepam, Aten, Rohypnol, and codeine syrup. We also have put down, in terms of the details, the number of outlets that were licensed per county. Nakuru, by the time we're putting this report together, we were at 1,812, followed by Laikipia, that have licensed a total number of 1,159 outlets. Narok has licensed 960 outlets. Uasin Gishu has licensed 767. Bomet has licensed 659 outlets. Trans Nzoia County has licensed 534 outlets. Kericho has licensed 368 outlets. Elgeyo Marakwet has licensed 315 outlets. Nandi County has licensed a total of 310 outlets. Samburu has licensed 237 outlets. Baringo County, 178 outlets. Turkana, 159 outlets. Kajiado, 142. And the last one is West Pokot that has licensed so far 92 outlets. In the entire region, out of the 14 counties, we have a total of 7,694 outlets. And to us, just to mention that we have one sub-county in the region that has no single outlet. That is Pokot South in West Pokot County, specifically a place called Lelan. Your Excellency, sir, also we managed to map out. We also managed to map out the hotspots for both illicit brew and drugs. So just to mention, we have a detailed report of all the hotspots. So we have places like in Nakuru, we have railways, we have Kasarani, Showground, among many others. And we also have Laikipia with places like Majengo Slums, Ukumbusho Market, Liki River, among others. And then Bomet, we have Lebekwet and Mogoma villages, among many other places that we've mapped out. For Kajiado, we have also quite a number of places. Ongata Rongai, Ngong, Matasia Town, Mbulbul, among many, many other places. Nandi County, we have Olomotit and Kaptuta villages along Mbogo riverbanks, among other places that we've mapped out. Turkana County, we have Lokomarinyang, Kaikor, Napak, Kibish, among other places, including places like California. Uasin Gishu, we have a long list of places we've mapped out. I'll just mention a few. That is, we have, there are quite a number of them for Uasin Gishu. So we have Kambi Amani, Toyo Bay Village. We have quite a number of them as you see them there. As you can see, for sure, we've mapped out so many places. Then we have Narok, Ololunga Junction, Kambi Chafu, among other places. In Kericho, we have Brook, Kericho Town, Ainawi Moi, Lemotit, among other places. In Baringo, we have Mochongoi, Kimoriot, Arabal, Marigat, among other places, including Tenges Center and Kapiemit. Samburu County, we have Maralal, Milimani, Suguta Town, Wamba, Baragoi, among other places. In Elgeyo Marakwet as well, we equally have so many places that we've mapped out. Chesongoch, Viewpoint, along Kerio River, bordering Baringo County, the Hanging Valley, among other so many places. For Trans Nzoia, we have Trans Nzoia, we have Pwatak Farm, Pango Farm, Bondeni, Namboko, Chemichemi, among other places. West Pokot, we have Aramaket, Kisima, Madare, Mawingo Road, among other places. In terms of accredited treatment and rehabilitation centers in the region, we have facilities that are operating, actually, that can serve our people, as we saw the numbers that are in dire need of treatment and rehabilitation. For South Rift, we have a total of 14 rehabilitation centers, Beyond All Love, Family Wellness, Presbyterian Care Center, Teens Challenge Kenya Nakuru Center, Mary Wairiri Foundation, Karira Medical and Rehabilitation Center, Jabali Wellness. We have Idlik Wellness Center, New Dawn, Zenesis, Willing Way, The Retreat Limited, Emmanuel Treatment Resource Center, Palm Tree Home Wellness Center. For North Rift, we have Moi Teaching and Referral, Elgeyo Marakwet County 10 Rehab, Lighthouse Hospital and Rehabilitation Center, Nuru Wellness, Haven Recovery Center, Serenity Africa, Adapt, Alumasi Rehabilitation Center, Talbot Center under the Catholic Diocese of Lodwar, Ichuman Wellness Center, Kabri Sang Rehabilitation Center in Nandi, which was done through partnership with NGAF, National Government Affirmative Action Funds. The same as the last one, Lodwar Rehabilitation Center, also done in partnership with the National Government Affirmative Action Funds. NACADA has funded a few, like Moi Teaching Referral, Elgeyo Marakwet County 10 Rehab, and one in Bomet. That is in the region, but NACADA has done many others in the country. The achievements, we managed to put out achievements we've realized in the region. The first one, through partnership with both state and non-state actors, we've been able to have a program that is alternative livelihood program targeting specifically the brewers. We had notorious brewers in the region, and through a partnership, we've been able to convince them, get them trained and engaged in other alternative ways of earning a living. And we have so far reached an estimate number of 3,000 in the region. We also want to commend the county government so far that all counties have enacted their laws in this region, and they all have functional directorates responsible for the alcohol and drug control function. Then as NACADA, through partnership with county governments, as I indicated earlier, and in collaboration with GAF, we have 5 key rehabilitation facilities in the region that we've been managed to put together, and they are serving this region. Then there is a significant decrease in the number of licensed outlets this particular year, estimated at about 20%. The numbers came down compared to the number of outlets that were licensed the previous year. So we really want to still commend everybody that really is taking part in this. Your Excellency, we hope that going forward, we shall work to ensure that this number comes down further. Then in terms of other achievements, just to point out when we do the work of enforcement, there are a number of achievements we've also realized as we work as a multi-agency in the region, that is so far within this a span of a period that we worked together, we managed to arrest and charge in court a total of 1,255 suspects. That is for a period of 100 days. Then we also managed to close 781 outlets in the region. And with all this, it attracted a fine amounting to 17,243,000. We also netted illicit brew that was amounting to 942,060 liters. With bang, we recovered 2,419 rolls. We also managed to collect 1,700 brooms, plants, and stems of bang. And we also managed to collect 100 stones and 24 kgs bulk, the one that is found in a sack. So weighing, it was about 24 kilograms. For cocaine in a region, that is most recent, and the case is still pending in court, we managed to get 54 sachets of cocaine. And one thing we want to commend our prosecution and together with the judiciary is that the culprit was denied bond. We've also managed during that period to net ethanol on transit amounting to 76,756 liters. Second generation, we got, during that period, 14 cartons, 2,485 pieces of assorted vodka brands. Cigarettes, we managed to collect 1,696 packets. For molasses, we got 10,750 liters. Yeast, we got 152.57 kilograms. And illegally manufactured beer in Kericho, when this illegal manufacturing was happening, we managed to get 678 bottles during that particular operation. And the value of counterfeit generally during that period that we valued in collaboration as we worked as a multi-agency, KRA were able to value all that was seized at 167 million. That is a great loss when it comes to if we don't really fight counterfeiting out there. Then, in terms of challenges, as we do this work, we've also pointed out a number of challenges that we experience. One is weakness in licensing and enforcement, and specifically we've pointed out the following. One is mushrooming of alcoholic outlets in undesignated areas, including wines and spirit shops. Secondly, the bars that operate without valid documentation, without licenses. Then abuse of licenses, sale of substandard alcohol in unhealthy conditions, outlets operating beyond stipulated hours, wines and spirits dispensing on site contrary to the law. Under corruption as a challenge, we also pointed out there's a lot of collection of protection fees, bribes to avoid closure and arrest, information leakage during crackdowns, and conflict of interest. Abuse of prescription drugs. We have a challenge particularly for unregulated sale of pharmaceutical drugs. And particularly, as I cited earlier, we have a big challenge with codeine syrup. And I believe that a lot can be done, especially with our colleagues at the Pharmacy and Poisons Board as well. Because currently what our young people are doing, they get codeine syrup, they buy Lucozade, ready to drink juice, they mix it up and they're able to come up with an intoxicating substance. So it's a serious challenge. Prosecution challenges, cases taking too long to conclude, lenient charges, sentences, and fines. Chiefs and security officers facing prosecution charges in court by brewers and peddlers. We have uncontrolled trade in ethanol and powder beer as a challenge. That particularly is brought about by diversion of ethanol to manufacture substandard and counterfeit alcohol, portable spirits in the market, illegal manufacturers, availability of powder beer to concoct illicit brew. Then with bank smoking is a big challenge. The region is one of the key markets for the cannabis coming from neighboring countries. For loss of revenue, counterfeit products and fake stamps during that particular time, we got what we estimated in terms of loss amounting to 81,900,000. Then the other challenge we pointed out as a multi-agency is that there is a challenge at the family level brought about by poor parenting, and one that was caused by the containment measures during COVID-19. People began drinking from home, and which is really interfering with the family unit. Also, we pointed out the emerging trends. The first one is the legal packaging of alcohol in personal houses. It's a big challenge in the region. Then hawking of illicit brew. People move around with backpacks, just hawking like any other business. Then sale of confectionaries laced with drugs, particularly the use of bang and heroin to make weed cakes and weed cookies. And lastly, as an emerging trend, we have currently unregulated online sale of alcoholic drinks, including home and office deliveries. So the other one that we pointed out is empty bottles, which is a big challenge, which is a contributing factor to the counterfeiting of genuine brands through recycling of empty bottles. There is need for a policy to assist in management of empty bottles. Recommendations that we've made as a region are: 1, alcohol and drug control being a shared function between both the national and county government. There is need for the establishment of county-based intergovernmental committees on alcohol and drug abuse. Secondly, we recommend the amendment of the Alcoholic Drinks Control Act of 2010 regulations to include and provide a formula for determining maximum number of alcohol outlets to be licensed in a given area based on population density as envisioned in the Act. Thirdly, we recommend that there is need to amend the county-specific laws to align with the national law, Alcohol Drinks Control Act 2010, so that they are in tandem, because currently they are not reading the same. Fourth, we've recommended counties to invest in research, prevention, treatment program from liquor licensing fees. We emphasize for ring-fencing of the funds collected from licensing. We have a few counties that have managed to establish a fund account, and our plea here today is to really plead, Your Excellency, that if the counties can all establish a fund that will be able to manage all issues to do with alcohol and drug control. There is also, finally, fifth, we've recommended there is need for decentralization of government chemist services, because currently we have a serious challenge. When we have samples in the region, we have to travel either to Kisumu or to Nairobi, and it is a big challenge. Sometimes when the cases are in court and the reports delay to be released, it really affects the verdict of our cases in court. We also recommend that there is need to ensure coordinated and multi-agency licensing regime of alcoholic outlets, where Ngao and National Police Service are also involved at all levels. We also recommend a need to undertake regular surveillance and enforcement to ensure compliance. We also recommend there is need to enhance community participation in control of alcohol and drugs, including licensing. We also recommend a need for a structured training for addiction professionals. As we talked about the huge number of people that are affected, there is need for personnel to be given capacity to handle the persons that are affected with addiction. There is need to standardize hours of operation of outlets so that they are all the same in terms of opening hours and closing hours. We want to thank you very much. Maybe just when we do raids, they are expected to supply the whole consignment for analysis. Sometimes it is quite hectic if you have like 100 grams of liquor that you've seized and you're expected to take it all for analysis. Previously, we just used to take samples so that through that you get the report to help with the processing of the cases in court. But currently, our enforcement team are really experiencing a big challenge because carrying a consignment to either Kisumu or Nairobi is a big challenge. Then shortly, Your Excellency, we also have a short documentary. When we're talking about the program for the reformed brewers, it's a short documentary for about 5 minutes only that we wish to play so that we really get to understand what we mean by a region that we managed to convince these notorious brewers to quit brewing in order to do something else in alternative. So, thank you very much. We're going to watch it briefly.
Kaunti ya Kisii.
Zaidi ya wauzaji na waraibu wa pombe haramu 1000 katika kaunti za Elgeyo Marakwet, Nandi, Pokot Magharibi na Uasin Gishu wameamua kuacha uraibu huo na kugeukia kilimo na biashara ndogondogo. Watengenezaji pombe ambao kwa wakati mmoja walikuwa sugu wamebadili mienendo baada ya zaidi ya miaka 20 ya kucheza mchezo wa paka na panya na maafisa wa polisi na mamlaka ya Nakada. Wengi wao ambao walitegemea vileo kulea familia zao sasa wana simulizi tofauti kabisa, kama anavyotuarifu Ben Kirui.
Lilian Adema, mwanamke mwenye umri wa miaka 41, ni mmoja kati ya wale ambao walikuwa wanajihusisha na biashara ya pombe haramu kabla ya kugeuka na kuuasi biashara hiyo. Tangia atoke katika kituo cha kurekebisha tabia na maadili miaka 10 iliyopita, mabadiliko katika maisha yake ni dhahiri, huku ndoto aliyoazimia zikionekana kuanza kutimia.
Na vitu inaitwa 5S. Wanasema start with what you have, start small, start slowly, start straight away and share with others. So mi wakati nilitoka mahali pale Eldoret, hii shamba ni shamba yangu, inafika hapa ni half an acre. Wakati nilitoka Eldoret, wakasema start with what you have. Sikuwa na kuku, sina kondo, sina chochote, na wamesema start with what you have. Nikauliza Mungu, nitaanza na nini?
Baada yake kuaga kituo cha kurekebisha tabia na maadili, Lilian alianza biashara ya kutengeneza na kuuza matofali pamoja na ukulima. Hajawahi kutazama nyuma tena. Katika miaka ya nyuma, nafasi hii ndani ya boma lake Lilian ingekuwa imetapakaa walevi kila mahali, lakini kwa sasa nafasi hii inatumika kuendeleza miradi ambayo anataja kuwa ya manufaa mno kwake.
Sijawahi jutia tangu niliacha. Nikatengeneza matofali, ma customers walikuja. Yaani matofali yangu ilikuwa inachukuliwanga kama ni moto.
Hata hivyo, majukumu ya kuwalea wanawe 6 nusura yamrejeshe katika biashara hiyo haramu. Dina Rono, mwanamke wa miaka 50, ana majukumu ya kuwalea wanawe 2 mikononi mwake peke yake. Baada ya miaka 20 ya biashara ya vileo haramu, alifanya maamuzi ya kuasi, akitafuta ushauri na kurekebisha tabia na maadili kabla ya kuzamia miradi tofauti ikiwemo ukulima, ufugaji kuku na kutengeneza sabuni.
Wakati nilirudi, nilikuja nikaunda sabuni, ikanisaidia sana. Nikiunda 20 liters, ninauza 3,000.
Anapotazama nyuma, anajivunia hatua ambazo amepiga maishani.
Wakati nilikuwa nikitengeneza pombe, mnakaa tu na walevi. Hata kama sikunywi, nilikuwa nimekaa kama mlevi tena.
Yvonne Chepkemboi ni mwanachama mwingine kutoka katika kikundi hicho cha kina mama ambao walikuwa wanatambulika kwa sifa mbaya ya ugemaji pombe haramu. Minyororo ya biashara hiyo iliyomfunga kwa miaka 8 sasa imekatika.
Hata chief sasa kwa upande wangu amepumzika, kwa sababu angetoka tu ofisini, kwa sababu ofisi yake wakati huo ilikuwa tu hapa karibu 100 meters, hiyo ilikuwa ofisi yake. So ningetengeneza sasa, ilikuwa tu kawaida yake akuja akipita kwangu, so amepumzika.
Hata kwa data crime yetu tulikuwa tumebrand ye the most wanted.
Tulipozuru kwake, alikuwa katika harakati za kupalilia shamba lake hili la mboga na nyanya. Kando na hilo, Yvonne anasimamia kikundi cha kina mama cha kuwekeza hela.
Nikaanza biashara ya kuuza manguo, ninatembeza. So ninaona income yangu si mbaya.
Lengo kuu la kugeukia miradi kulingana na makundi haya ya kina mama ni kupambana na umaskini na pombe haramu.
Na hiyo ni biashara nilikuwa nimezoea. Nilikuwa sioni kuna biashara nyingine naweza fanya. Mimi nilifanya biashara ya kwenda kuleta mboga kwa soko, nikiuza nyumbani, na nikafungua kioski yangu nikiendeleza.
Safari ya mafanikio ya kina mama hawa ilianzia hapa katika kituo cha mafunzo na maendeleo cha Ukweli mjini Eldoret, kinachofadhiliwa na shirika la Empowering Lives International.
Inahusu wamama zaidi wale walikuwa wanatengeneza pombe. Baada ya kupata hiyo tunaitwa mabadiliko, will of change, na wakisha toka hapo ndio tunafundisha some skills.
Zaidi ya wanawake 2,000 wameondoka hapa, maisha yao ikiwa imebadilika mno.
Once we have trained these women, we just let them go to the villages where they go and practice what they have been given as Empowering Lives International.
Kati ya kaunti hizo 4 za mkoa wa Rift Valley, Elgeyo Marakwet ndiyo inayoongoza na uraibu wa pombe haramu. Mamlaka ya kukabiliana na ulevi na uraibu wa dawa za kulevya na kada imeweka mikakati ya kupambana na hali hiyo kwa ushirikiano na kaunti ya Elgeyo Marakwet.
The purpose for starting this project was because from the surveys we had done earlier, this county was extremely affected by addiction issues. And that's why we decided that we come up with a partnership between us and as NACADA and the county government. And I must say it has been very productive.
Na huku vita vya kukabiliana na pombe haramu vikishika kasi sio tu kwa kaunti hizo 4 za Rift Valley, mamlaka ya NACADA inasema itakuwa inatumia mbinu sawia kugeuza waraibu wa dawa za kulevya za aina zozote. Kirui, runinga ya Citizen.
Thank you very much, Your Excellency. That is the short documentary, and as a region, we've worked very, very closely. As you heard in the video when we were saying Empowering Lives International, we have our key partner just to briefly speak for 3 minutes. Thank you.
Yeah, Your Excellency and all protocol observed, thank you so much for availing ourselves this day to experience what God is doing in Empowering Lives International. My name is Reverend Dr. John Bouchenet, the CEO of Empowering Lives International. For sure, what you have seen here, Your Excellency, is what we are doing in the villages. We just give them skills and ideas so that they can go and use it back at home. And that is why you see these ladies, as they were talking exactly on what ELI is doing in the villages. What we do is that we have 3 attributes of a world changer. 1, we make people embrace Christ. 2nd, we give people God-honoring income. That is the skill. And the 3rd, we make people have the skill of sharing the transformation. And of course, after we have given those 3 attributes, we let these ladies go and practice it back at home. Currently, we are working in 5 counties: Elgeyo Marakwet, Nandi, Uasin Gishu, and of course Baringo and West Pokot. And out of the 3,000 women you have had there, we train about 2,000. The rest 100, they got the training and the ideas from others because of what they are sharing.
Has been grappling with due to drugs and substance abuse. We have all heard the clarion call. We have a God-given opportunity to serve. Let us work together in restoring sovereignty in our beloved country, Kenya. I thank you all. Thank you. Maybe to conclude, to the police officers, please, you have our support. Do what is right. Let us ensure that our society is saved from this menace. Again, as we said while we were in Nyeri, we are not going to allow the illicit brews, alcoholic drinks, and drugs to exist together with our officers. Kwa hivyo, moja mpaka aondoke. Na hapa, juu pombe hawezi kaondoka, ni polisi ataondoka, si ni kweli? Kwa hivyo, wacha tuondoe hii pombe, alafu sisi tuendelee na kazi. I know we have a few challenges here and there, internal challenges, correction of some protection fee here and there, hard changes here and there. Please, abia maofficers wenu waachane na hiyo. Tufanyie wananchi wetu kazi, tufanye vizuri, na sisi at the end of the day tutakuwa tumebarikiwa sana. Asanteni sana.
Thank you, DIG. Now it's my honor to invite my Cabinet Secretary to come and introduce his colleagues and make a few remarks. And
our country or protocols observed. Excellency, allow me to introduce my colleagues, members of the cabinet, who have joined us here today for this very important occasion. Before I do so, I think the PS for Internal Security and National Administration forgot to introduce one other senior officer in our midst, and that is the Secretary for Public Prosecutions, Dorcas Oduor. She is representing the Director of Public Prosecutions. Your Excellency, in our midst, we have the Honorable Kipchumba Murkomen, Cabinet Secretary for Roads and Transport. We have the Honorable Soipan Tuya, Cabinet Secretary for Environment, Climate Change, and Forestry. We also have Davis Chirchir, the Cabinet Secretary for Energy. Last but not least, my sister there, the Cabinet Secretary for Labor and Social Protection, Florence Bore. Your Excellency, sir, since we are not doing very well with time, I will be very brief. I would like to say the following. First, I thank you for profiling the fight against illicit and toxic alcoholic drinks and narcotic drugs to the level of your office. Your support and leadership will go a long way in helping us get rid of this problem that is one of the major cancers eating into our society. Your Excellency, allow me also to say the following, that the sale and use of illicit and toxic alcoholic drinks, as well as narcotic drugs and psychotropic substances, is a national emergency. It is not a small matter anymore. We have been on this topic for a few years now, but we in the Interior Ministry are convinced that unless we address this cancer and this problem with finality, we stand to lose the next generation of Kenyans who will take over and take forward this country when everybody seated here will be gone. Your Excellency, I would like to clarify that we are not against licensed traders in alcohol. Traders who are allowed to engage in trade in alcohol, they have been licensed, and they are selling products which have been given approval by the Kenya Revenue Authority, the Anti-Counterfeit Agency, the Kenya Bureau of Standards, which are agencies of government, have nothing to fear. And I want to direct all officers involved in this crackdown not to use the excuse of this fight to harass, intimidate, extort money from legitimate traders and business people who are engaged in the business of alcohol. We have already received reports. Some of our officers have taken advantage of the effort that Your Excellency are leading to harass business people who are selling products which have been approved by government agencies. And even if I know we've had another discussion about how many licenses should be issued, that is a different discussion. Any trader, any business person who is selling products which are licensed and they have been approved by the agencies of government should not be harassed simply because of this crackdown. This crackdown, Your Excellency, is on illicit alcohol, toxic alcohol, which is laced with poisonous substances, which is ruining the health of our children, our men and women, which is breaking our families, and which is affecting economic development, as well as narcotic drugs and psychotropic substances. I hope all officers have heard me. So in this process, any officer who veers away from the very deliberate and focused efforts of cleaning this country from dangerous substances and from drugs, that officer will be on their own, and we will take action without any further reference. Your Excellency, thirdly, I'd like to say that we have scanned the threats that we consider the most dangerous and the most critical threats for our national security. The first one is terrorism. I want to commend all our security agencies who for years and months have made sure that our country remains free from the threat of terror. And although the public may never know what our officers do every day, Your Excellency, I want to report that in the last 6 months especially, the war against terror has gained momentum, and I can proudly report that we have been able to detect and thwart what would have been catastrophic attacks on our country's security. We are going to increase our alertness and make sure that never again will terrorists find their way to hurt us the way they have hurt us in the past. Number two, we have a problem in about 13 counties, with 8 counties being most affected. The problem of criminals who are engaged in the organized crime of banditry and livestock rustling. Once more, I commend our officers who, especially in the last few months, and these are officers from both our internal security organs